Good morning, everyone. So, today I'm going to demonstrate the procedure of placental examination, which is an essential part of third stage of labor. It helps to ensure that the placenta is complete and to detect any abnormality that may affect maternal as well as fetal health. So, before starting any procedure, we have to do our hand washing to prevent cross infection. So, I have done my medical hand washing as well as I also follow the universal precaution. So, here is freshly separated placenta from a mother. Coming to its structure, so you can see the placenta is in circular shape. So we can say this is circular disc or discoid which is attached to uterine wall. Now I'm going to show you the two surfaces of placenta. This one is smooth shiny where umbilical cord attached. This is known as fetal surface, and behind that just opposite next is maternal surface which is rough, spongy and has a dull red color due to the maternal blood. The next thing is, what about the volume of blood in mature placenta and what about its normal weight? So the weight of placenta is 500 grams and the volume of blood in mature placenta is about 500 ml. Next, I am going to check the diameter of placenta. So the placental diameter is 15 to 20 centimeter. You can check the diameter of placenta with the help of measuring tape, or either you can take the thread. Here I am using thread to check the diameter of placenta. So firstly, you have to place finely the thread over the surface of placenta and then mark the reading. So I have marked the reading. Then to check the accurate value of this mark reading, I am checking this with the help of measuring tape. Then place the mark reading over the measurement tape and check its value. The value I get after checking the diameter of placenta is 15 centimeter. So the next step is to check the thickness of placenta. So the placental thickness is checked with the help of pathological caliper, but due to the absence of this caliper, I am not able to check its thickness, but I can tell you the normal range of placental thickness. So the placenta is thick from the center, that is 2.5 to 3 centimeter, and thin from the periphery, that is 1.5 centimeter. Across the fetal side of placenta there is a presence of tiny fetal vessels which I am showing with my finger. So the main function of these vessels is to transport oxygenated blood to the fetus as deoxygenated blood and waste away from it. Fetal membrane consists of two layers. One is chorion and the another one is amnion. The outer is known as chorion and the inner is known as amnion. The layers I am separating here, the inner one which I am showing you is known as amnion, which is smooth, shiny and is in contact with liquid amnion. And the outer one is known as chorion, the layer which is representing the remnant of chorionic levee and at the margin of placenta. Now it's turn to know about the umbilical cord. So umbilical cord is also known as funis or U cord. And what about its length? So its length is 30 to 100 centimeter and its diameter is 1.5 centimeter. So here you can see there is a presence of folds around the umbilical cord. So these are not some complication, but this appear because of a presence of Watson jelly. You have also learned that in the umbilical cord there is a presence of two arteries and one vein. The umbilical vein carries the oxygenated blood from the placenta to fetus. So I think you are able to see these two are arteries, and just opposite to these two arteries there is a presence of one vein. You have to always remember one thing, that the maternal surface of placenta contain 15 to 20 convex polygons, which is also called as lobes or cotyledon. So the structure and function unit of placenta is called as cotyledons. So here in this maternal surface there is a presence of cotyledons. So you have to always keep in mind that after the separation of placenta from a mother, you have to immediately count the cotyledons. If some cotyledons remain inside the uterus, it will lead to infections such as endometritis or even retained placenta. The last point you have to keep in mind that The attachment of U cord is always in fetal side of placenta and in the center, but in this case of placenta you can see the U cord is attached in the periphery region. So this placenta is an abnormal placenta which is known as Battledore placenta. I think you have found this video a very informative video, so thanks.